more recently in the media, you've been hearing about fasting, particularly intermittent fasting. People like Walter Longo and others have done some fabulous research talking about narrowing the feeding window, just not eating, for example, at night after you have dinner and not eating again in the morning, so that you have a period of anywhere between 12 and 16 hours every day of fasting. Even that period of fasting, just that 12 to 16 hours, is enough to induce metabolic changes that's been associated with improving health, improving glycemic control or glucose control, reducing the recurrence of breast cancer in a study that was published in JAMA. So even these fasting mimicking interventions have been shown to be quite helpful to people, and they're things that people can do safely on their own. But what I'm going to be speaking about this morning is primarily medically supervised water-only fasting. That's the complete abstinence of all substances except pure water in an environment of complete rest. Water-only fasting in our facility ranges from 5 to 40 days. It's important to understand that not everybody's a good candidate for water-only fasting. In order to determine if you're a good candidate for water fasting, it does require a medical history. It's important to have a physical examination and also to have baseline laboratory of testing done in order to be able to tell the difference between a healing crisis, a positive acute response of the body in an attempt to get well, and a problem. You really have to have some information in order to guide yourself, and that's why medical supervision with water-only fasting becomes an important issue if it's going to be safe and effective. There are many conditions where water-only fasting would not be appropriate. Pregnancy and lactation are rather obvious. If you were to water fast a lactating woman, she would lose her milk production. A condition called anorexia nervosa, which is a neurological condition where people pathologically restrain from eating. Type 1 diabetics don't do well fasting because you need a certain amount of insulin production in order to be able to adapt to the fasting process. If a person's had a recent stroke, myocardial infarction, pulmonary embolism, or DVT, fasting is a problem because until they've been stabilized after their condition, the physiological dehydration that occurs in fasting could, at least in principle, increase the risk of a clot. Cardiac instability, conditions like atrial fibrillation, particularly for those on anticoagulant therapy. Severe kidney disease, if the kidneys aren't functioning at a certain level, you really can't process the products of fasting, and that would become a problem. Genetic conditions like porphyria or MCAD, which is medium chain acetocoenzyme A dehydrogenase deficiency. It's a rare genetic defect where you can't break down fatty acids. These are patients that would not be fasted. If a person is cachexic or depleted, they have significant deficiency, obviously you'd want to replete them before beginning fasting. If you can't stabilize a patient off most medications, that's a problem because medications can become potentiated in fasting. And if you're not able to rest. Rest is very important in fasting because if you maintain normal activities during water-only fasting, what happens is once you've depleted your glycogen stores, your body still has baseline glucose needs, both by the brain and the muscles. And if you increase your muscle activity, what happens is that muscle activity will increase glucose needs, and the only place the body has to draw that fuel is from the breakdown of protein through a process called gluconeogenesis. And so it's important if we want to burn fat and not muscle that patients have rest during fasting. So conditions that are favorable to fasting include obesity, elevated blood lipids, high blood pressure, and type 2 diabetes, essentially metabolic syndrome, the condition that's affecting the vast majority of people in our society. It also turns out that there's evidence that fasting is effective in helping with autoimmune disorders. Autoimmune diseases are diseases where the body's immune system begins to attack itself. Autoimmune, self-immune. Cancers like lymphoma, gastrointestinal imbalances, this whole microbiome, there's 1,000 strain of bacteria living in your gut right now. There's about 5 pounds of bacteria. Think about that. You have 1 trillion cells, 5 pounds of bacteria living inside you right now, living, eating, drinking, and pooing inside your system as we speak. And what those bacteria poo inside you largely depends on what you feed them. So if you feed them meat, fish, fowl, eggs, and dairy products, you're going to get products including things like TMA, which becomes TMAO. trimethylamine oxidase, which is thought to irritate the lining of the vessels and contribute to heart disease and other issues. On the other hand, if you feed your bacteria soluble fibers, which are their natural food, then you get fertilizer and you make things like vitamin K and things that you need. So you want to make sure that your bacteria are pooing healthy stuff inside you, fertilizer, rather than toxic waste, and that's going to be dependent on what you put in your mouth. And also dependency and toxicity issues. For example, most smokers, by the second or third day of fasting, report no withdrawal effects, which is interesting. Now, some people say, well, yeah, they're probably so miserable fasting they don't even think about the cigarettes, but I don't think that's true.